Hi, Dean, the Duke family, the Feagin scholars, and everyone over there at the leadership conference. Thank you for asking for us to tell our stories and put our input about what we're all going through in this COVID crisis that's affecting the whole world. My name's Fritsch. I was one of the orthopedic sports fellows at Duke in 2008 and 2009. I work now as a knee specialist in Sydney, Australia. And just like everyone else, the COVID crisis has really changed our lives. We're pretty lucky here in Australia that we're a long way away from everyone else. We had a little bit of time in advance, and our government and our community acted quickly and aggressively to get things under control as best they can be in this situation. So whilst life has changed a lot, it feels like we're doing well. Australia, I think, has had a total of 97 deaths, but that's come with a big change in our lives. We closed our borders in early March. Our essentially community went into lockdown around the end of March. All elective operating ceased the last week of March, and we transformed into a lockdown community trying to avoid the spread of COVID. So that's had a huge effect on our lifestyle, huge effect, personal costs. Of course, if we want to look at the negatives, but also many upsides. Changes in the way we connect with everybody has probably been the biggest thing for that. We feel a real connection with our colleagues around the world through initiatives like this. We run our own fellowship program here. We've been in very close contact with all our fellows around the world through Zoom meetings and video calls and email, etc. Really reaching out to people that we maybe haven't been as in contact with as much up until now. And that's one of the real upsides to come out of this, is seeing how connected we are. I think the world's seen that we're connected for good and bad. And I'd like to focus on the positive parts of that. From a very personal point of view, it's been great catching up with the family, having the kids at home. We've done homeschooling for about 6 weeks now. A lot more time with them, a lot more research during the daytime rather than at night. After hours, a lot more exercise. All those things are good. Professionally, our hospital, my hospital, was one of the primary COVID hospitals in Sydney. We developed many of the protocols for treating COVID in orthopedic patients, simulated them, modeled them, tried to get them out to other hospitals, working with physicians around the country to come up with the best way to do that. So I transitioned from being a knee subspecialist back to doing trauma in that setting, much more trauma, virtually no elective knee orthopedics, and a lot of very rapid learning as best I can on viral epidemiology, sterilization protocols, etc. And it's always great to learn new things. That's been a real upside. Watching my department come together, watching the whole hospital come together, and watching the medical community in general come together has been pretty inspiring, I must say, worldwide. Again, we're fortunate that our numbers have been so low due to rapid movements and plans we put in place, but there's certainly no hesitation in the medical community to get on the front line and do anything that was required. There's always outliers in that. There's always different opinions, and it's been an eye-opening experience watching how leadership's worked around the world. You can see different models of leadership, different models of community solidarity and community engagement. And you can literally see the differences in the number of infections, the death rates, the mortality rates, and the way the communities are coming through that based upon the responses to those leaderships. And I think there's going to be a lot to learn in that area to look at for many years to come, a lot to debate. We've learned a lot here that Australia has a lot higher solidarity than we may have felt we had 6 months ago. 6 months ago, it seems like lots of little issues that we're all worried about and really felt all the differences between us seem to have disappeared. And we're all come together with a common goal to try and get the best possible health outcome. Now it's about trying to figure out how we balance the economic outcome with that. That's going to be massive. It's severe. But I must say, I think overall, it's been eye-opening to realize how many things we have in common, how connected the community is, mostly for good, how when we have to, we can all work together. The one thing I've learned through Duke and through Dean that it taught us there and that I've really felt useful in this time is the idea of leadership at every level. And that's sort of the message I've tried to subtly put into practice myself and spread around a little bit, is that message that we all had to lead at this point, from our Prime Minister setting the goals that he thought were appropriate. Not all of us agreed with that, or the speed. There's always going to be disagreements. But whenever anyone will complain about that, you could easily suggest, well, leadership occurs at your level too, whether it's just my kids stopping seeing their friends, stopped all their sports, school finished, to my friends in the community, that we all had to do the right thing with social distancing, my parents, us, through to community leaders, through to hospital leaders, through to physician leaders, that at every level there's been an opportunity to lead by simply doing the right thing, sending the right message, doing what needs to be done. Even if you feel like you're not getting the right messages around you, you could do it. So, or try and do it. Don't profess to get it all right, that's for sure. But leadership occurs at every level. Everyone has a chance to be a leader, and I think we're seeing that now. And I'm really, uplifted to see how well our community's embraced it, and I think worldwide everyone's doing their best to do that. So I'll be joining via the virtual meeting. Thank you for organising that, changing it's hard to get from Australia to Durham for the leadership conference generally, so I'll be happy to join it when we can do it remotely. Thank you for the lessons that we were taught during my fellowship. Dean and the whole team there, Alison, Bill, and T, who were running the program when I was there. My thoughts go out to everyone around the world, to my Duke family there, and I really look forward to when we can catch up in person soon. I miss that.